everybody, Dr. Britt Talley Daniel MD. I'm talking today on what is confusional migraine. I'm a neurologist, a headache doctor, I'm a writer. I've written the only book in American literature in the last 25 years on Transient Global Amnesia, and also a big book on migraine, which is a textbook, and both of those are listed on Amazon.com. If you just bring up my name, and there's a print and ebook version of them. So what is confusional migraine is the subject today? Well, basically it's the development of acute altered sensorium with confusion, irritability, drowsiness, nausea, or vomiting following mild non-concussive head injury. It only affects children and adolescents as it currently exists and is well known. So something like 10% of school-aged children have migraine, and out in the migraine group, 1 in 6 will have acute confusional migraine. Probably this diagnosis is underdiagnosed, and the actual occurrence may be greatly behind. Hippocrates, 300 years before Christ, introduced the phrase sick headache, which is migraine. Migraine turns on your vomit center and makes you nauseated and sick. And Galen was a Roman physician in the 3rd century who introduced the term hemicrania, which means half a head, and they took off the HE off that word, and you're left with mycrania, which later became migraine. So the problem with acute confusional migraine is it's an evolutionary diagnosis, actually, and people have recommended that the diagnosis be added to the International Classification of Headache Disorders, but it hadn't happened. Some people have said that if they did that, pediatricians and others would more easily recognize this, would have better information about the occurrence and prevalence of it. So we just don't know. It's also been linked to transient global amnesia, which is thought to be affected to adults, and some writers think that it's just transient global amnesia occurring in children. But again, this is controversial and it's not completely worked out. So many times these attacks can occur, like with migraine, spontaneously, and many of the patients will have headache, nausea, vomiting, sensitive to light, kind of a passive apathy, drowsiness. They may want to go to sleep after the attack. And many of them had to have visual images, like a migraine fortification spectra, seeing half the things, zigzag lines, blackouts, and stuff like that, which really ties the condition into migraine, in my opinion. All the tests that are done in the brain, like a CAT scan and MRI scan, are normal. Sometimes EEG will be slow. And you have to rule out the condition called transient epileptic amnesia, which will have a positive EEG and responds to treatment with anticonvulsant medication. And those are really shorter attacks also, where these attacks last maybe 4 hours, 5 hours, and they should be gone, it'll be over about 24 hours. And transient epileptic amnesia, really short attacks, lasting just minutes. And of course, there's a differential diagnosis of other things that can cause this, because they present with amnesia in the emergency room. And parents and pediatricians and ER doctors are naturally quite concerned. So a subdural hematoma, epidural subarachnoid hemorrhage, because 40% of these patients would have mild head injury. They could have meningitis, non-convulsive seizure or status, metabolic problem, and stuff like that. So what are the symptoms and how you diagnose acute confusional migraine? Well, they're named by their most prominent symptom, which is confusion, which means the sufferer is disoriented, as would happen in time just before the attacks and for a varying period of time afterwards. The child might be restless, doesn't want to sit still, it's very vague in answers, and children anyway are difficult to get a history from. We have to rely on parents in this situation. An intense confusion suddenly starts and may last longer than the headache. And many of these patients do have headache with it. So the symptoms can be headache, memory loss, anxiety, agitation, blurred vision, dizziness, speech impairment, disorientation, sense of place and time. But they're not allowed to have any abnormality on neurologic exam, such as altered reflexes, a stiff neck, fever, blown pupil, or papilledema, or anything like that. After the episode, the patient usually falls into a deep sleep. The patient may present with a personal history of migraine or a family history of migraine. The problem with that is many people don't know they have migraine, and they have really what they think are just mild headaches. They're called sinus headache, sick headache, hungry headaches, menstrual headache, nocturnal headache, and the so-called migraine syndrome events, which are not named well, but they really do have migraine. Migraine is genetic, it's inherited, it's in family. So what's the cause of acute confusional migraine? Well, the cause is not certain. So 40% of patients have a mild bump on their head, and that's thought to be non-concussive, and they're not really sure what that is. There are certain things that can aggravate migraine. There's a long list of things that can do that. What's the differential diagnosis of this? Well, I've gone through that already with stroke, hemorrhage in the brain, clots in the brain, meningitis, and things like that. How is migraine linked to amnesia? Well, I'll tell you, there's a huge link of migraine to amnesia. And the first one I always go to, and I had written about that in my big textbook on migraine, which is like 400 pages, 900 references, and also in the book I wrote on Transient Global Amnesia. The one to go to there first is Living, L-I-V-E-I-N-G, who was a neurologist in London, England at the end of the 18th century. And his neurology is supreme cataloger and savant regarding all things to do with migraine. He published a big textbook in 1873. And so I'm quoting Living now. And he called migraine megrim, M-E-G-R-I-M, because the word migraine hadn't fully gotten to the English language as an understanding probably till the 20th century. We have to next consider the disturbance of the higher several functions, which sometimes attends the megrim paroxysm. This may be regarded for the most part either intellectual or emotional. The former is represented in some instances by loss or impairment of memory, and others by confused, incoherent, or tumultuous ideation, very rarely by hallucination, later by general depression or vague feelings of anxiety and dread. And he talks about a specific woman who had this. She had the affectations of sight that migraine patients have with visual symptoms, and after that her intellect becomes confused and her memory at the same time for about half an hour, so she can't even remember the name of any medicine she's just taken. And with another case, Dr. Livingston said, as the visual phenomenon passed off, his memory usually failed so much that for a time he was mentally incapacitated. Whatever he read or did during that past time left no impression. So the history of this goes back into that period of time. He really didn't describe acute confusional migraine, nor did he describe TGA, Transient Global Amnesia. But something like 16 out of 67 of Livingston's patients had confusion, trouble with memory, or disturbance of consciousness. But after Living, confusion as part of migraine attack was rare in the neurology literature. And probably the next one who started writing about it was Dr. Murch, and he was the first neurologist at the Mayo Clinic where I was able and lucky to train in neurology in the 70s. He wrote an article in 1924 in the American Journal of Psychiatry on, quote, psychic manifestations in migraine, and said that, quote, during the clouding of consciousness, amnesia frequently occurs. There's amnesia again with a migraine. And he reported on 2 patients with amnesia during migraine attacks. Okay. Then since then there have been other articles describing this occurring as maybe a migraine equivalent or complicated migraine. Those are kind of vague terms. The article I've written on my web post, and you might go there to look at this, if you will go to Dr. Migraine, www.drmigraine.com, and look around and enter in the search there, you can find an article on confusional migraine listed. And I have a large bibliography of other articles that can cause this. And people have proposed that maybe something like the thought for what causes transient global amnesia, which is the spreading wave of depression that spreads across the brain, knocking out the hippocampus and the temporal lobes and causing trouble with memory. So, this is the end of my discussion of transient confusional migraine. You need to read some more about it. It's a very complicated problem. As I've mentioned to you, it's still an evolutionary stage by saying what it is and what's caused it. That's the other problem with transient global amnesia. If you look at my big textbook on it, I have a picture of Gauguin, the painter, with a confused look on his face, because the world has really not completely stated what is transient global amnesia nor acute confusional migraine. It may be migraine with transient episodic spreading depression. So good luck to all you parents or children who've had these episodes, migraine, confusion. God bless you all. I'll see you again on the next talk. Bye-bye.